So, you may be thinking about being a nurse. Well, let me tell you a few facts that will help you decide. What kind of education or what kind of degree do you need? Well, one of the great things about being a nurse is the fact that it's so flexible. There are 3 different entryways into nurses. One, you can be an LVN or an LPN, which means a licensed vocational or practical nurse. You can have an associate's degree, registered nurse, or you can have a bachelor's degree, registered nurse. Your LVN track usually lasts about 1 year to 18 months. Your associate degree nursing is usually 2 to 3 years, and your bachelor's degree nursing is it's usually a 4-year degree. Sometimes it takes a little longer, just depending on how long it takes you to get in. As far as getting into school, nursing school is extremely competitive. The best thing that you can do is have your sciences, your microbiology, your anatomy and physiology 1 and 2, and make A's in those sciences. That's going to be your best way to get into nursing school. Why would you want to be a nurse? Well, how much do nurses make? The average salary of an LVN is generally about $47,000. As far as the RN goes, or the registered nurse goes, it's $73,000. So what does a typical work day look like? Most nurses work 3 12-hour shifts, but nursing is so flexible. You can work in a doctor's office, so where you may just work 8 to 5, 4 days a week. You can work for a home health agency, and you may only work 2 or 3 days a week. So that is probably one of the very best things about nursing, other than you're able to take care of patients. Is the flexibility it gives you to help take care of your family. So as far as soft skills go, how you present yourself for a job interview, the top 10 soft skills that nurses need are communication. It's very important that nurses know how to communicate, both with the physicians, the patients, or their peers. They need to have a great attitude and confidence. They need to be able to work in teams. Nursing is not an individual sport. It's very much a team sport. You've got to have the help of your peers, your physicians, the ancillary degrees, which would be physical therapy, occupational, respiratory. You need to be able to think critically. Believe it or not, patients don't always do what you expect them to do. Sometimes they do something completely different. Sometimes they will, their body does something different than what you're going to expect. You need to be able to be professional. You need to have boundaries with your patients, boundaries with your fellow peers, and you need to be empathetic. Empathy is different from sympathy, from the simple fact of empathy allows you to feel what the patient's feeling. It's not about you, it's all about the patient. And you need to be adaptability. Flexibility is the word that I use for nursing school because it could change as fast as tomorrow. What do I wish I would have done differently in my nursing education? I wish, when I went to college, which was 100 years ago, I wish that I would have went right into nursing instead of chemistry or biology. I knew I had to have those courses, but at the time, nurses weren't as respected or paid as well, and they were really encouraging people to do anything but nursing. Now, everything has changed. All the baby boomers are aging, and we're going to need so many more nurses to take care of people as they get older. Some of my favorite things about being a nurse, you can really gross out your friends with stories. Again, you can gross out your parents too. Better yet, you get to stay up all night if you work the night shift, plus you get paid for it. There are so many different kinds of nurses out there. You can have nursing attorneys, nursing informatics, forensic nursing, flight nursing, bedside nursing, home health nursing. I could go on and on. I think there's about 70 specialties that you can get into if you want to be a nurse. so you'll never get bored with your career. I teach in nursing school, so some of the students, some of the difficulties they have is not having good study habits to begin with. They come into nursing school, they've never had to study before, and it's a little bit of a rude awakening. So make sure you learn to have good study habits while you're in school. Pay attention to your classes, especially your sciences, and make sure that you do some sort of volunteering, whether it's at the nursing home or at the hospital, something that can get you interacting with patients so you'll know if it's something that you want to do. Nursing's a great profession, and if you have any questions, you can contact me, and Ms. Davidson has all my information. Thank you very much.
Administer loading dose now, yes or no? Yes, we want to administer our loading dose.
Okay, good.
And our loading dose to set
2.4 milligrams.
Okay, 2 point.
So you're gonna use your arrow to do that, and you can just press on it. If you go too high, you go down arrow.
The blood products rapidly.
Okay,
Yeah, I can
so
do
like if
that.
we wanted to give fluids of some sort really rapidly, then